Okay. Just a few housekeeping things, and Eskadar, if I forget anything, I'm sure you will please chime in. At the top of your screen, there's a little speaker icon. If you can mute that speaker, since you're listening to it over your phone, it will help with any feedback or any other echoes and kinds of things that we sometimes get. And I also wanted to let everybody know that we want to have time at the end for any questions or comments that people have. We'll let Tom do his slides and then, excuse me, and then go through and have time for questions because this webinar is being held for the 8 health departments that GEARS is providing technical assistance to for data to care on this round, and we really wanted to make sure excuse me, that this was a forum for all of you to be able to have conversations and ask questions. So please feel free to do that. We don't want it to feel really formal, although I do want to let Tom start in a second and get through all his slides first before we open for questions. And also just keep one eye on the lower right-hand corner in the chat area, and Eskadar will be putting any notes that we need there, and if you look there now, you'll see that she lets you know that the webinar is being recorded. So I think we should just turn it over to Tom, unless, Eskadar, do you have anything else to say before we hand the mic over to Tom?
No, you've covered everything. Thank you, Eve.
Sure, you're welcome. Okay, Tom, thank you. Go ahead.
Great. Well, good afternoon, everyone. My name is Tom Shavor, and I'm a technical assistance consultant for GEARS Incorporated. The webinar today will focus on the Accurint person searching software package as developed by the LexisNexis Corporation. Our learning objectives today include the following. First, I'm going to briefly discuss the background around locating persons out of care, as well as the reasons why person searching software is an appropriate tool to use for this purpose. Second, I will discuss the Accurint software application in a bit more detail. In this section, we will learn how the software is typically used, discuss data sources where the information comes from in a standard Accurint search, as well as some examples of professions where the software is utilized. I will then discuss some of the strengths and weaknesses of person searching software, identify the cost and license requirements necessary to use this software, as well as consider some of the legal aspects and benefits of using Accurint in your own program. Next, I will cover the Accurint manual and batch matching processes in more detail, first describing how to conduct a manual search, and then moving on to describe how to create a file for batch matching, and then discussing the final file that is produced as a result of this activity. I will close with some cautions about security and confidentiality, and finally, we will have some time at the end to answer any questions that you may have. Now, as anyone in public health knows, finding where people actually live can be very difficult. In general, I think it's very safe to say that our clients tend to be very mobile. And in fact, many of our clients move several times a year. The primary limitation with using HIV surveillance for data to care activities is the accuracy of current address information stored within EHARS, or the Enhanced HIV/AIDS Reporting System. Now, please understand that I believe the current version of the CDC EHARS application to be a first-class database for the storage and collection of HIV-related client surveillance data. That said, current address information captured within EHARS is primarily limited by whether a client is in care and receiving lab tests, which trigger the current address to be updated within the application. Additionally, patient addresses within our databases are primarily updated from labs that are imported via ELR, or electronic laboratory reporting. Though in some areas, manual entry remains the primary method of updating current address. In either case, people out of care will not likely have the most up-to-date current address information within EHARS. Current address within EHARS may be updated through RIDER as well, or the routine interstate duplicate review, a process that state health department surveillance programs use to identify earliest address of diagnosis, also as well as through record search activities. However, this may not be timely enough to provide the most accurate information on a person's most current residence for data-to-care purposes. For clients not in current address is frequently inaccurate. In fact, many states have clients in the EHARS databases with current addresses more than 20 years old. This dates back to a time when name-based reporting may not yet have been implemented in a particular state, as well as when the data systems in use at that time didn't have the ability or capacity to capture current address information as robustly as it can today. All of these things are potential limitations in trying to locate and re-engage persons out of care. So, what is Accurint person searching software? Accurint is a software package owned by the LexisNexis company, an information service company based in Atlanta, Georgia. Additionally, Accurint is a subscription service that allows the searching and analysis of publicly available information. Also, a point-of-need investigative solution enables government agencies to locate people, detect fraud, uncover assets, verify identity, perform due diligence, and visualize complex relationships. It's currently being used by over 3,000 governmental agencies within the United States. So the Accurint software application has various strengths and weaknesses that I would like all of you to consider. Some of the strengths of Accurint include the fact that the software application provides a direct connection to over 37 billion current public records held within 10,000 distinct databases. It's also a web-based application that is accessible anywhere the internet is available. Furthermore, the database allows for easy monitoring database usage through administrative reports. The software's batch matching process gives the end user the ability to automatically perform numerous searches quickly. Weaknesses of the application include that the potential approval process to use the software may be lengthy. While this may vary from site to site, it took about 9 months for me to get Accurint approved in my former state of Tennessee. So this is something to consider if you're thinking about using this software. Additionally, the software could be expensive for agencies with few available resources. And finally, the output from Accurint or any other database of this type is not 100% guaranteed. So all results should be evaluated for accuracy. In terms of the cost and licenses required to use this application, costs may vary per site. For example, each Tennessee Accurint license was about $160 per user per month. Unfortunately, I don't have any other pricing information available at this time. For sites who are considering using Accurint, this is something that your sales rep will go over with you. The base cost of each license includes unlimited manual matching or one-at-a-time searches. Now, I'd like to give a quick word of warning here for those of you who aren't yet using Accurint or who are thinking about it. You're absolutely not allowed to share licenses among your program staff. Each person conducting searches within the system must have their own license, accompanied by their own unique username and password combination. And this is actually a good thing from an administrative perspective, because in case there are concerns about inappropriate use, managers will be able to know who searched with records. Now, moving on to batch matching, the cost depends on if a successful match is made. So the average price is approximately 50 cents per client matched when both address and telephone information is returned on each client. So now that we've discussed cost and licenses, let's speak about the legal aspects of using Accurint. The first question I would ask is, does your state already have an agency that uses it? And this is something that can be discovered from your state's contracting staff or possibly even legal services. And the reason I'm starting off with this is that most people probably have a legal agency or another agency within their state or government that's actually using Accurint. And if so, you only need to probably have a simple contract amendment to start actually using it. If you discover that your site is not currently using Accurint, then the next question to ask is, can you legally use the software? And to figure this out, I recommend that you get your legal team involved. Here are two important things to discuss about this system when you're talking to your legal team. First, Accurint saves encrypted copies of all searches for a period of time. This is done in the event of a lawsuit where a court orders the release of this information. Having encrypted copies of data on HIV-infected persons on a non-health department company server may not be legal in your state. The second thing to consider is that some states cannot legally share certain types of client-level data over state lines. And if this is the case, you may not be able to legally use Accurint unless these legislation has changed to allow these activities. Now, while I'm sure there are numerous other examples that I'm missing here, the bottom line is simply to make sure that you involve your decision makers early in the process. In my experience, here are some of the benefits of using Accurint. First, I was able to obtain more accurate and more timely current address and address history in the event that no recent labs on a client were available. Second, out-of-state vital status or death information seems to be available more quickly than using the SSDMI or NDI matches that HIV surveillance programs already do routinely. While the information given by Accurint is only a date and place of death, that is usually enough to begin an investigation about a client's vital status. Third, batch matching, or the ability to perform matching activities on multiple people very quickly, is an extremely powerful tool and has the potential to greatly improve the quality and timeliness of address information within surveillance data. So in this next section, I'd like to discuss the standard Accurint manual matching activities in more detail. In the normal manual matching process, clients are searched one client at a time, and all searching is conducted on Accurint's online website, www.accurint.com. And as a result, there's no software installed or maintained on the end user's computer. To conduct a search, you can enter as much or as little information as you like into a search screen. Results are then displayed on your monitor, and these results may be exported into Microsoft Excel or any other processing program, or printed if you prefer. So I'll begin this next section with some screenshots of the Accurint application. This is a screenshot of the Accurint main screen that you would use to sign into the application. And this is what the main search page looks like. Now, to give you an idea of what a normal search result looks like, I'm going to search for myself. So in the next few slides, you're going to see the results of this search. The search parameters that I'm putting in today are simply my name, Thomas J. Shavor, and my date of birth, 8/13/1967. And this is what Accurint produced for the information that included in my search. So let me pull up my little handy-dandy. Here we go. All right. So the first thing I'd like you to notice is that in the red block on the left where the green cursor is located, that the system is giving variations of my name based on how many various data sources have spelled my name. I'll cover that a little bit more in a second. In the blue block here, please see how it gave two different variations of my Social Security number. Now, these data are locked on the initial search and must be manually opened to view them by clicking the lock, which is right here. You can probably see where it says View SSN You'll be able to see this a lot more clearly on the next slide. Finally, in the purple block here, list every address I've lived at since 2000. And the green block on the far right lists all of my telephone and cell phone numbers. This is just a better view of the variations of my name and Social Security number in the results screen. Again, I want you to notice how many different variations of my name are listed within different data sources over the course of my life. One, in fact, even actually included my middle initial here as part of my last name. And again, to show you the locks, when you first do an initial search, you only get to see the last 4 digits of a Social Security number. In this case, I have 20261 and 0281 that are listed. Now, I'm not going to tell you which one's real, but if you have access to the system, you can simply click on View SSN to actually view the entire Social Security number. Another part of the output for manual matching is the real-time phone search results. Real-time phone search results give more detailed telephone and cell phone information, including the name of the phone carrier, as well as approximate dates that these numbers were associated with me. The red block here happens to show my address and telephone information when I first moved to Tennessee back in 2001. Now, in the next section of this webinar, I would like to discuss the standard Accurint online batch matching activities in more detail. So in addition to performing individual searches one at a time, Accurint gives you the power to search for locating information on hundreds, thousands, or even tens of thousands of people simultaneously. In my work in Tennessee, I used Accurint to match my entire eHearth database, which at the time comprised over 32,000 clients. During the standard online batch matching process, the end user creates a comma or tab delimited text file with the variables they wish to match on. Accurint can only process files that have either a .csv or .tab file name extension. I create this list by first exporting the eHearth person view data set and then modifying it to the file structure that I wanted. That said, you can create a list of clients to search on in any way you like, just as long as you end up with a text file for submission through Accurint. Now, the variables that are normally included in the file include any combination of name, address, city, state, zip code, date of birth, Social Security number, and phone number. In my experience with using Accurint, I generally used as much information as I had available in order to allow the searches to be as accurate as possible. I would like to make a quick point that one state who uses Accurint believes that the use of the Social Security number by itself to perform searches has given some misleading results. Thus, it's probably a good idea to try different variable combinations in your search methods in order to determine what works best for your own client population. To continue the matching process, the end user then goes through the process described in the following slides to upload the data file to the secure Accurint server. Once matching is complete, the Accurint software will send you an email notification that a file is ready to download. At this point, you simply log into the secure Accurint website, download the appended file, and begin to evaluate the results. So to start the online batch matching process, you first log into your Accurint account and then navigate to this screen that you see on the right side. Here. You can see the highlighted areas in yellow labeled People Matching and Phone Matching. You can click on either of these links to begin your batch match. I'll review both of these. People batching allows customers to obtain updated address information on the supplied individuals within the submitted file data, while phone batching allows customers to obtain updated telephone information on the supplied file data. This first screen of the batch match process lets you know how much these searching activities will ultimately cost your agency. While these amounts are small, each agency needs to be aware of how much these searches could ultimately cost. For example, a search of 10,000 people could potentially have a price tag on the order of 50 cents per person located, or about $5,000. Now, more than likely, Accurint will not provide matching information on every single person you submit in the upload file, but each agency must ensure that they understand the potential costs involved in this activity. Now, there's no charge for people who do not match, and in my experience, upwards of 85 to 90% of those people you submit in the file will match. So my advice would be to first conduct a very, very small search, say with 10 to 50 people, in order to evaluate the results of the match before you commit to spending a large sum of money on a larger data set. So step one, this is the first screen of the batch and address search wizard. Here, you need to create a file name for your batch job. Let me see if I can show this to you. In this particular case, I call my file name test. You can call it whatever you like. And then you're going to enter your company ID for the job. I don't know what these mean because they'll be happy to give you this information. In the second step, we select the file we wish to upload into Accurint. So, using here, all you have to simply do is click the Browse button on the right and locate where you saved your text file. You'll also need to specify whether this file is comma delimited or whether it's a fixed width file, or CSV or tab, respectively. Finally, you'll need to specify an email address where you would like your batch match notifications to go. This address is where you will be notified when your batch match is complete. Before we get to the next step, in order to show how to begin the batch match process, here is a dummy example of the first row of a text file that we are going to hypothetically upload into Accurint. Our client's name in this case is Brett Rice. He has a date of birth of 8/13/67. He lives at 1100 Alderman Drive in Alpharetta, Georgia. Now we get to the meat of the batch process. During this step, we're going to specify to Accurint the type of data held within the column of your text file. For example, let's remember the example from the last screen. Here it is. First, we start with our very first variable. Once you upload your data file into Accurint, the program will show you the first field value from your original text file. In this case, it's the word Brett. Over to the right side of the field value, you're going to locate the field value column and select what type of field it is by clicking on this little drop-down arrow here. Now, in this case, I know that this is the client's first name because I created the file. So I will click on the drop-down arrow on the right side of field label and select as a response, first name. Now, at this point, you simply go through each variable in your file down the line and describe exactly what type of variable it is. In this case, the name Rice is the client's last name. This is the client's address. This is the city he lives in, the state, the zip code, and we had Social Security number in this particular dummy file, so we included it here. As you can see by the screenshot, there are many choices to include. However, missing from this particular screenshot is date of birth, which is also available for use and is critical, in my opinion, to get a good matching result. Now, unfortunately, you cannot enter multiple dates of birth within the basic batch match process, but there are custom batch matches that can be created, and to do this, you'll need to contact your Accurint sales rep for a little bit more assistance. Step 4 of the search wizard allows you to customize the output you receive from these search results. Now, before I cover this section, let me say that if this is confusing for you, assistance is available from your Accurint sales rep when deciding the types of output you're requesting. Let me click on my handy-dandy cursor. For this example, I selected that I wanted EDA, or Emergency Directory Assistance, phone numbers on my clients. And that I wanted 3 phone numbers to be returned on each client. The search results can give you anywhere from 1 to 6 address and telephone combinations in the resulting output file. I've personally found that 3 address and telephone results yield just enough information to locate clients who you haven't been able to locate, while avoiding extraneous information that you would have to spend staff time evaluating. Typically, this comes in the manner of older addresses and older phone numbers. Additionally, at the bottom section, you can select Address Append, which I'll get to here. And this is where in the batch match process results, you will include various types of address information on your clients. The screenshot also indicates a section that will allow the batch match to include updated address information, as well as the number of addresses to be returned and the number of months of address history to be considered in the search. In step 5, we select the permitted use certification information that you would normally select when you log into the system. As a note here, when you originally get access to Accurint, this is something that will be covered by your sales rep. And it's based purely on your access rights within the application. In my experience, I've selected Click to Continue for fraud prevention here, or detection, but your specific permitted use case may be different. DPPA stands for the Driver's License Privacy Protection Act. It was passed in 1994 and covers the privacy and disclosure of personal information gathered by state motor vehicle departments. In the process of gaining access to Accurint, you will need to complete a lengthy survey which will determine what category you will need to select here when you log in. For example, when I worked in Tennessee, I selected court law enforcement. Where is it? No. Oh. Court law enforcement or governmental agencies. This could be different depending on what type of agency you are. Finally, in the last step of this process, it gives you an order confirmation summary. If any of this looks wrong, now is the time to click the back button. Because once you hit the next button, which is Authorize Order, you just paid for a batch match search. Okay, there we go. Now, after the site uploads their data file to the secure Accurint server, the software performs the matching process as specified and returns an appended file that contains both the original data submitted by the site as well as additional information detected by Accurint. Depending on the size of the file, it may take several hours before you receive an email telling you that you have a file ready to download. You will then log into Accurint and download an appended file. In this example, if you think of the file as being viewed in Microsoft Excel, the original data file that you submitted to Accurint will be as shown on the top, starting with cell A1 through F1. So if you remember our example of Brett Rice, if you're reviewing this text file in Microsoft Excel, this top bar here, these 6 variables are what we submitted in our original file. Assuming the example above is where you submitted a file with 6 columns for batch match, an appended file would be returned to you, and any additional data obtained by Accurint would be located in columns 7 through 12, or in Microsoft Excel speak, columns G1 to L1. Thus, your appended file will have 12 columns of data, 6 from your original file and 6 from Accurint. So let me show you what this looks like. So the top bar here, this is our original data set. Accurint then, after it does batch match, will send you back an abbreviated, or excuse me, an appended file where you will have your original data along with the data that they obtained through the application, and attached to the right side or here of your original file. So what you would see is, you would see in your original file would be A1 through F1, and then anything that Accurint produced would be added to the right of your file, G1 through L1. In this particular case, it came up with some different things. It actually came up with a different address. In this case, it's saying that Brett Rice now lives in Nashville, and he has this phone number. Next, I'd like to say a few cautionary words about security and confidentiality concerns when using Accurint. CDC's position on using person searching software is that it is a local decision about whether or not to use it. They offer cautions for its use, so we recommend that you consult your HIV surveillance epi or project officer to obtain all of these cautions. Their primary concerns include, first, that the potential disclosure of a person's health information, specifically HIV status. Second, the potential misuse of personal information submitted by the health department and retained by the person searching software. Third, these concerns are heightened by the fact that the health department learns of the client's HIV status through disease surveillance, a process that does not involve client consent. Cautions from CDC include not using the words HIV, AIDS, or STD in any contracts or communications with person-searching companies. This applies both to the client names being submitted as well as the health department staff communicating with these companies. You should also consider whether or not you can combine your request with other units of the health department in order to minimize the risk of disclosure that the staff work within the HIV/STD programs. Finally, learn what information the company retains, or how long it is retained, and who has access to it. You may be able to negotiate a reduction in the time the personally identifying information is retained, and to add other safeguards into the contract. So in conclusion, I believe that Accurint is a powerful tool that can help to improve the quality and accuracy of our HIV surveillance data. Using the application to conduct batch matching can decrease the time it takes to process large volumes of clients, to provide information you need to locate clients for data-to-care activities. Finally, security and confidentiality awareness is extremely important when using this software. Please ensure that your security and confidentiality policies include a section on using the software, and that training for its users is occurring as necessary. Thank you for your attention. Are there any questions or comments from anyone on the call?
Thank you so much, Tom. I'm going to ask, Eskidar, can you unmute everybody? And if you could mute your phones when you're talking, would be really, unless you're talking, would be really helpful. So I just want to open it up and see if anybody has any questions for Tom, whether you've used Accurint before or not.
Hi, Tom and Eve. This is Pascal. Hi.
Hello, Pascal.
Thank you for going through that. That was helpful. I got a question for you. So I was wondering, let's say that you were matching a name that was pretty common, and so there would be potentially multiple matches. Would you get them back with some kind of ranking of which one might be the same as yours?
Well, it's really going to depend. Well, it depends on if you're using, are we talking about a manual or a batch match, first off?
I guess a batch match.
Okay, great. Okay, so if you're talking about a batch match, it's really going to be defined by the data that you put in for your search. So in this particular case, if you're using if the person has a common name, you probably would want to try to use as much information as possible. The good thing about Accurint is that because it uses uses an address history as part of the matching algorithm, if your particular John Smith, for example, lived at the address that you have in EHARS, it should come up as a hit and define who that is.
Oh, right, right.
Okay. Yeah. Now, if you gave John Smith with no address information, you're going to have a big problem.
Okay. And so then when they turn up as a match, like your example, I guess it's this question of, how certain do you feel it's the same person?
Well, the information that Accurint gathers is anything that's publicly available. And, when the process, and these algorithms are secrets. I don't really know what they are. They've been described to me, but I honestly don't know how they conduct these matches. But when they're culling through all these different types of data sources that they have available, renters insurance agreements, utility bills, and just driver's license records, and all the sorts of things that we have available, the more information that you put in, I found gives you much better information on the output file. So if you're able to put in a person's address, where they live, and a date of birth, and a potentially social security number, also a middle name, if how the middle name versus a middle initial, the results you're going to get are very, very accurate in my experience.
Thank you.
You're welcome.
Tom, we have a question in the chat box. I believe it's from Wisconsin.
Okay, I don't see.
He pretty much already answered it. That's okay.
Okay.
Ah, there it is. How many addresses do you use in a batch match? So you can use, I think the basic batch match will handle up to 3. However, you can do a custom batch match, which I alluded to in the presentation, which is something where an Accurint representative will actually sit down with you and develop what they call a custom batch match, where it uses many more databases than are used in the standard batch match process. For example, it actually includes things like incarceration records, active prison records. It can include lots of other things. So you may be able to get much more robust results using a batch match. But in this particular case, you can use 1, you can use 3. In the past, I've always used just 1 primarily, and as long as it's an accurate address, the system was able to identify pretty positively, who they were.
So you meant this is Casey again in Wisconsin. Would you recommend, if states can afford it, to do the custom match? I mean, do you feel like that's better, or do you think I didn't realize there was kind of this wizard process.
Well, it's kind of it's not a secret thing. I mean, they talk about it, but it does require some time. Now, let me just say that, the individual batch match that you're going to do on the application is perfectly fine. I mean, I did that for a long time. However, you can get probably more robust information by doing the custom batch. Now, there's no additional cost for doing this, okay? It's covered in your license fees. So all you have to do is just say, well, hey, Accurint sales rep, we want you to come and help evaluate our business process and see if you think a custom batch match is what we need. And they'll send somebody to your health department and talk to you at length, evaluate your business process, and say, hey, this is what we can do for you on a routine basis. I think that the advantage of doing a custom batch match would be, particularly if you're going to combine your matches with other programs. in Tennessee, I did a lot of matches for the immunization program, where they're out of their 2-year surveys, where they were looking for mothers that had not brought back their infants for immunizations. I worked with tuberculosis and a few other different agencies, and I find that if you can kind of streamline an approach where you have like one matching algorithm that's applied to everyone, you can have something that's just developed that's off the shelf and you just apply it and do it, and it's pretty easy to go. Are you currently using batch matching in Wisconsin?
No, we're not. We use it like every single day for individual record searches, but it's a priority for us for data to care because we're one of the states that has like the current address is 20 plus years old, and we need to clean this out.
I understand. Yeah, I mean, if you're using Accurint currently, then you already have batch match capability. I mean, I would suggest to go ahead and actually set up a batch match, just a regular standard batch match, and give it a go.
Okay.
And then as you instead of waiting, because I mean, it may take a while for the custom batch match process to be developed and defined and that sort of thing, you know. But I mean, with I think the information that you got today, hopefully you'll be able to actually go back to your computer and actually set up a batch match of just a few clients and be able to push it through and see if it works.
Yeah, I wish.
Actually,
go ahead.
Oh, go ahead.
I just wish I understood, and maybe you can shed some light, not the exact algorithm, but just thinking when we do manual searches, you know, we'll put in a birth date and a name, and we can find a match, but the match is really based on like an address because either Accurint doesn't have the birth date or it's different, or maybe we don't have Social Security number. So when you get a match out, and I think it kind of alludes to what one of the other callers said, how do you know it's a match? It matched on all or part of what you put in?
Right. Well, in the basic batch match that you do online, you are dealing with a smaller number of data sets than you would in a custom batch match. So really to answer your question, you know, I don't know what the algorithm is. I can tell you that, you know, when we talk about data, we're talking about data that are associated with people. So, you know, if you go to your local Kroger grocery store and you apply for one of those membership cards to get you, 10 cents off your gallon of milk, okay? If you put in your name and your address and phone number, that becomes publicly available and mineable information at that point, okay? And someone's going to buy that, in this case Accurint, and to be able to create profiles of people that they're going to mine. So it really depends on what information has been put out there to the universe for people to collect. I mean, it's theoretical. Say somebody has never owned an apartment and they live with their parents. They've never paid a utility bill. They're not going to show up in any kind of, any of those databases because they actually they're not on it. They haven't contributed anything. They may have a cell phone, so they'd show up in a cell phone database. They wouldn't show up in, say, electrical bill database or a water company database or a mortgage database. You know what I'm saying? In general, I think, obviously the more information that you're able to accurately put into the system, will improve your results. But that said, there are going to be some people where you just don't have a lot of information and you're really not sure that the results you get back are accurate. And that's just the nature of the beast, I think, with dealing with these types of huge metadata sets. Did that answer your question?
It does. Thank you.
Okay.
I wanted to let everybody, this is Eve again, let everybody know, I realized I didn't say this when we started, that the 8 health departments that GEARS is providing technical assistance to are Nebraska, Georgia, Wisconsin, Mississippi, Texas, City of Houston, Tennessee, and Fulton County, Georgia, which is part of the Atlanta MSA. If you are from one of these health departments other than Nebraska, Georgia, Wisconsin, Mississippi, or Texas, could you send us an email in response to the invitation just so for our records we'll know which states, which health departments called in? I'd appreciate that. But I also want to leave lots more room for discussion. So other questions or concerns, experiences, don't feel like any question's too basic. We really wanted people to feel comfortable to ask whatever they needed to overcome or, address the possibility of using this for their day-to-day care. We found that many health departments just tell us this is just the most efficient way to really get the most accurate address. So we want people to feel comfortable using it or at least know what they need to do or what their steps are. If anybody has any other thoughts or comments on security or confidentiality, I'd certainly invite that. We've got about 12 minutes left in our time, so I want to use it if we have more questions or comments.
We have more questions in Wisconsin but don't want to dominate, so please others ask first.
I think Wisconsin is invited to ask.
Yay! All right.
People will have your questions. They just don't want to ask them. So go ahead.
We were wondering about, so you've finished the batch match. You have your matches. You feel confident. You want to get them into EHARs. Do you have a really nice SAS code that makes it into an importable document already?
Well, unfortunately, I don't. I no longer work for the health department. That said, you can create an EHARs template in the existing EHARs application to import this information. Now, you're going to have to use, I think it's the generic ID. You'll be able to use, one of the things I didn't really dwell on, let me see if I can get to it really fast, is that, cruise through here. LexisNexis assigns, right, next screen. No, it's not there. Crap. Okay. Can you see the screen?
Yep.
All right. Can you see this ID right there?
Yep.
It's called a Lex ID. So anytime that you do any type of matching activity, you probably noticed this when you did your manual matches. LexisNexis assigns a unique identifier for all of the data for this person. This is their unique identifier for me, my unique identifier. So you can actually import this as well as other information into EHARs. You'll have to import the Lex ID, again, under the generic ID, I think is what the schema requires you to call it. You can't make a new variable called Lex ID in EHARs. You have to use one of the ones that's existing in the application already. I think generic ID is the one that I used. But yeah, we actually imported in Tennessee. We imported, address information and, telephone information, all sorts of stuff on patients.
So you just take the whole results of the match and maybe you do some kind of spot checks, validation, whatever. You take that document and you import it. Is that true or not?
Well, you can.
Okay.
Particularly on cases where you talked about earlier that where patients are like 20 or more years old.
Yeah.
And this is probably a good way to clean up those types of patients that, back in the 80s and 90s, we just didn't have, the data systems weren't as robust. And back then, the information we collected on clients really wasn't a lot. I mean, in Tennessee, I can only speak for my state, in my former state, most of the older patients in the beginning of time, in our database, didn't even have address information. That was just something that wasn't collected, because of the political environment at that time. So you've got these people that are still marked as alive living in your state, but how do you deal with that? You suspect they're not there anymore or possibly deceased, but you don't have a lot of information. You can use Accurint, particularly for these older clients, and then actually do a batch import and update their addresses as well as vital status.
Okay, super.
Yeah, and I'll be happy to talk to you at length any other time you want to about that.
Okay.
Yeah, I see something on the chat. Let's see, we've got MORB states and the manual match methods. How many is too many number of client records in a state's database? I'm not sure what this question is asking or who asked it.
Hey, Tom, so this is Andy at CDC.
Thanks, Andy.
Some states I serve have about 1,000 patients reflected in their database, others maybe 4,000. I was just wondering how many thousands before one would not even consider the manual approach for matching?
That's a good question. I mean, I think that in a low morbidity state, I think what I would probably do is, in terms of data to care, you probably could get off with just doing the individual level searches with no additional cost, the normal routine one-at-a-time searches. However, a batch match would come in handy if you really wanted to clean up your entire database, at one time and just really clean it up well. I mean, I don't know what the magic cutoff is.
I think that's a great point, that after the first go-through, however you do it, at that point, hopefully it's just more of a maintenance effort.
Yeah. I mean, in Tennessee, I did my entire database, I would match once a year just to see, and I would compare and contrast our lab data with what Accurint produced to see, do we have any patient migration, and if so, where is it occurring? And, particularly we look at patients that have migrated out of the state that we didn't catch on RIDER or through record search activities. But you might be able to, depending on the number of staff that they have at the health department there, they may be able to get away with just doing them manually. But probably once a year would be a good way to do it. And it wouldn't be that expensive with that few people in their databases. Does anybody else have any questions I can answer?
Well, thank you so much, Tom. This has been incredibly helpful from some of the comments we're getting, and I'm really glad we had this opportunity to present this information. If you have any follow-up questions that happen afterwards, please feel free to send them back to Escadar, who sent the original email to you with the invitation information. In addition, if we don't already have your email address, because we're working closely with you or have it from a meeting, a site visit, if you could send your email address to Escadar as well, I'd really appreciate it, because we'd like to send out an evaluation afterwards, just a very short one, but it really helps give us important information for making our TA as helpful and pointed as possible. So, last call. Tom, anything last to say?
No, it was truly my privilege to be able to talk on this webinar today, and if we can assist you in any way we can, please let us know.
Okay. Thanks, everybody.
Thank you.